Well, welcome back, Spear Summit 2018. Here we are, Wes and John, the dental guys at Spear Education's. This is a premier conference where we've created a lot of community. We're taking education to the next level, and who other than talk about dentistry, where we've came from, what we're doing today. You may have just seen the live broadcast in here where we were talking about using digital things to communicate with your specialist, interdisciplinary communication. What has digital done for us? John, speak to that a little bit, because we were just talking about that before we got live here.
We have Dr. Frank Spear here to talk about this because, one of the hallmarks of course, Spear Education has been interdisciplinary approach to treatment, having a team approach. And, I want to talk through kind of where we are today a little bit with digital, some of the things it's allowed us to do that we maybe could do before, but not as efficiently, and then talk about some of the things that are maybe still some challenges where we're still evolving and we're still learning about that. And Dr. Spear, you were just right before the show talking a little bit about what it used to be like to go through preparing to discuss a case with your team versus what it can be like today. And I think that's one of the major advantages of where we've come. Talk through that a little bit with us.
Yeah, so I was mentioning the fact that I've been part of this study club since I think it was 1983 is when it started. And it was actually interesting little story that you guys might enjoy because I don't think you've heard it before. It was formed by a general dentist in Tacoma, Washington. His name was Ralph O'Connor. And Ralph O'Connor and his partner Dick Klein, back in the 60s and 70s, in dentistry in the U.S., were huge. And so they used to travel and lecture on practice management. And it was in the era in the 60s when, traditionally a dentist worked out of one chair and stood up, right? Wow. And then you get high-speed handpieces in the late 50s, and suddenly you start getting chairs where you can sit down. And Ralph O'Connor and Dick Klein realized, hey, we could start using one assistant, two assistants. We could start having hygienists learn to do more. We could do, quote, four-handed dentistry. And so that was their lecture. They traveled the country saying, hey, guys, don't stand up. Don't stand up and work out of one chair.
Interesting.
Look at how much more dentistry you can do. If you sit down with two assistants and two chairs and you got them numb, look at all the amalgams you can do.
Efficiency increased fourfold.
Oh, massive.
Yeah.
So that's cool, right? I mean, Ralph is like so popular, and he and Dick are so popular all through the 70s. In his own practice, he recognized he had this big problem. The patients that fit his practice model were patients who only needed operative dentistry.
Okay.
If you had a patient with tooth wear, if you had a patient that had malaligned teeth, missing teeth, needed prosthetics, it didn't fit his model. And so he literally started accumulating a box of these cases that he didn't know what to do with. And he was a super bright guy. And so in 1983, he called 8 of us, 8 specialists. He says, I'm going to have a meeting with you 8. And he's still alive today. He's a very cool guy. He's in his late 80s now. I'll meet him for this first to get together about what he wants to talk about. And he says, here's why we're getting together. He says, I've got all these cases. I don't know what to do. And the reason I don't know what to do is because you guys need to be involved. Because these people have patient problems. I don't know what to do with them, but you guys do. So we're going to form a study club so I can treat my cases. And that's why we're going to do this. And by the way, he said, as long as we're in the study club meeting format, none of you are specialists. You're all limiteds. Because that's what you are. You're limited in what you do. So we're going to get together.
Wow.
And so what we would do, which feeds into your question, is we would get together, and we used to do it back then every month, 9 times a year, 3 to 5 hours each time. We would bring in records, right? You'd bring in your models, you'd bring in your radiographs, you'd bring in your photographs, and we'd sit in a room, typically in a restaurant someplace or in one of our offices. We'd all sit around a table. And, back then, how did you share records? you had to pass the models around, and you had to, and we'd put the photographs up on the screen, and Ralph would run our meetings. And if you ask where did I learn my treatment planning skills, it wasn't grad school. It was actually there.
Oh, that's good.
Interesting.
So what Ralph would do is he would say, okay, everybody look at the records. Let's put the photos up. All right. Nobody else is allowed to talk. Orthodontist, what do you see when you look at this case? Nobody else is allowed to talk. Endodontist, what do you see when you look at this case? And he wouldn't let anybody speak at all until everybody at the table had an opportunity to say, this is what I see. And once we went all the way around the table and everybody had the opportunity to say what they saw, you realized that you had blinders on.
Yes.
Because even though I went through a perio and a pros program, I didn't know and see what the orthodontist and the endodontist or the pediatric dentist who said, well, if this would have been done 10 years ago, we wouldn't be here right now. And so that was where I learned my skills of treatment planning. Because interdisciplinary treatment planning for me came from sitting at a table with a group of people that had different vision than I did, and not allowing anybody to interfere with their process. So that you'd go, wow, I never would have thought of treating the patient that way until I heard you say it. Never would have occurred to me. Because as a restorative dentist, we have blinders on.
Absolutely.
And that's today why we still are so, study clubs here at Spear Education are a massive part of our organization, because that environment still exists. Now we make it a whole lot easier to have a study club and to be part of a study club. And so that was the impetus when we originally started our study clubs, was my history of being in one. Plus, I used to run 15 of them at one time myself back in the 80s and 90s. But so now we get to the records part of it. So the old way, as I said, a study club was easy because you're sitting at a table. But in practice, because you were working maybe with an orthodontist that you didn't see routinely or somebody else, every patient that was going to be part of an interdisciplinary treatment plan, every single practitioner ended up getting their own records.
Oh, man.
Everybody.
You got good at duplication.
You got your models, you got your radiographs, you got your photos. Everybody's got their extra set of whatever they needed. So, I did my exam. I got all my records. Patients went to Vince Kokich. He did his exam, got his records. They went to Dave Matthews. He did his exam, gets his records.
Man.
You're like, today, as we know, that's the kind of stuff where digital is just amazing. And so there's that part of digital, to me, was the easiest to embrace.
For sure.
I mean, because it was, once we switched to digital photography, digital radiography, that didn't require more time. That took away time because you just were sending everything to everybody.
Right.
And then some of the other current things that I think digital has made much easier is manipulating potential outcomes. So you were mentioning about implants, Wes, earlier, and you can interact with your surgeon, send the cone beam over, talk about what you want. We have a really innovative orthodontist in Tacoma who was Vince Kokich's original partner. Doug Knight's his name. And at our last study club meeting, because that group still gets together about 4 times a year now, so we're closer to 70 than 60s, all of us. So what Doug is doing now is he is now scanning every patient that comes in. And when he proposes an orthodontic plan, he actually uses a manipulative software, and it's a free software. I think it's Screencast-O-Matic is the name of it. He puts the models in it, and he emails the dentist, what are you thinking about your implant plan? Were you thinking about opening a space for an implant or 2 implants here? Were you thinking about me trying to close the space for this? And Doug's really good with technology, which we're going to talk about the learning curve here.
Right.
So Doug literally turns on his screen capture, manipulates the model right on the screen, opens the case up, opens the space up, looks at how that would affect the occlusion, does another setup where he closes the space, looks at how that affects the occlusion, sends it over, to the dentist, and it's a 3-minute video, and says, which of the two treatment plans would you prefer? Do you want the do you want the space opened in the 2 implants, or do you want the space closed in 1 implant?
Compared to an old orthodontic setup, cutting teeth off of models
and
wax.
It's fast.
It's fast. Now the downside, as we were kind of talking before this all started, is the learning curve for some of that software is awfully steep.
For sure.
It is, and I mean, like CEREC. We've had CEREC in the office now, I think, 10 years. I know how to run CEREC for simple restorations. I can do a single posterior just fine. I still enjoy always having a technician that's doing the aesthetic part of what I do. But you look at what people that are talented are doing with CEREC, like full rehabs and beautiful anteriors, but they put in a lot
It's
of
a passion they have.
Yeah.
Yes, this whole idea with 3D printing in the office, milling in the office, all of this. We talked a lot about this in the last few months, as far as there's a lot of sexiness to it, and it's certainly it can be amazing, but the amount of time that you put in and the learning curve to get really good at this it's a big deal, and you have to. It's a labor of love, much like CEREC is if you want to be truly excellent at it. And I remember when Sam Puri, we talked to him last year, and he said don't. A lot of these things are not things you buy for ROI as much as maybe we're told that, but it's more if you have to love it. You have to truly love it.
And I think I was mentioning to you guys that 2 years ago, I think on this program, I ended the last title of my lecture was Analog versus Digital, and everybody was expecting me to get up and talk about dentistry, and instead I was talking about digital photography versus analog photography, or digital music versus traditional music. And I'm a big audiophile. I have great systems in our 2 homes, and I listen to vinyl. That's almost the only thing I listen to, because I like the experience of it. For me, if you love the computer and it really juices you up to learn how to do all that stuff, you can go tremendous ways with digital right now in dentistry. But if you're like me, as I said to you, you got 2 grandkids at home, you got 2 puppies at home, you got a wife, you want a life. I'm not going to put my nose in a computer X hours a day to learn at this stage in my life. I'm just not.
Right. Well, the discussion that I think we had about this previously too was that there's ways that this is being maybe. You hate to use the word sold, because these are good things. It's not like they're just being sold and that there's no value. There's a tremendous value to it. But I think that there's a lot of people that don't understand really that there's not necessarily the return on investment for these things. And I think it's important that people understand that this is about again, loving this, being passionate about it. But I think for Wes and I, even though we've embraced and we're scanning and we have cone beam CT in our office and we're big believers in printing and all this, but we also understand that there are people out there who have done a lot more of this than us at the lab, who are very talented and who have not only the skill but the capital investment ongoing that they're investing in. Our lab just bought a new $400,000 printer after a couple years ago buying another $300,000 printer, and so can we keep up with that in the office at the level that the laboratory can? And I want you to maybe speak to Smile Design, because I think it's an area where you have obviously made a huge impact on the way we think about Smile Design and discussion with patients and translating that into clinical outcomes. And I wonder what your thoughts are on some of the software that's available out there for Smile Design, and how does that compare in terms of not just effectiveness but efficiency, and what your thoughts are on that.
Before I do that, I would just, since you both have CBCTs in office and scanners in office, I think when we do talk about digital, we have there without question. There's things where digital helps you do treatment better, and I would certainly put CBCT in there as one of those things that would I want to do the kinds of things that are being done in dentistry today without CBCT? If you knew you had the ability to get CBCT, no.
It's a game changer.
I mean, so. Not just even things like implant planning, but all the other stuff that you see, the marrying of CBCT, the ability airway assessment with CBCT,
Right.
joint assessment with CBCT.
Yep.
It's an invaluable tool.
Yeah.
It's kind of like you see the iteration back then whenever they came out with high-speed handpieces.
Yeah.
Now
Yeah.
we can set down.
Yeah.
Right.
Well,
It changes everything.
Now I'm going to
Yeah.
show you
Yeah,
a 360-degree view of a tooth.
exactly.
Or
Versus
how it's
2D.
changed just endodontics, for instance.
Right.
I mean,
Right.
it's just amazing.
So it's kind of like a no-brainer. But there
Yeah.
are some kind of things that we feel like John's saying, that, the initial 6, taking that and having that ability to just immediately throw it up there, and within 10 minutes, have someone that's
Yeah.
manipulating in PowerPoint.
Right.
Just a few little overlays.
Yeah.
But then there's all this smile design stuff.
Yeah,
and-
so what do you
so Christian Coachman has been a friend for long
Amazing guy.
decades.
Awesome.
So talented, both as a dentist and as a clinician, and as a creative inventor.
Yes.
Right.
And so I've watched what Christian does with his digital smile design stuff, and there's no question it's really impressive. For me, it goes back to the issue of, I think it's really impressive. Now, could I get to that same place with some composite and a model in a relatively efficient amount of time? Probably.
Yeah.
Or, if you even look at it today, just the ability to do some digital design of some overlays and have them milled out by your lab. I mentioned Matt Roberts, and you can send a model to Matt and photos to Matt with your overlays on it, and pop, the next thing you know, you got this snap-on smile yourself, and then you can tweak the composite and do all of it, and you weren't the one sitting at the computer and making all. So I love watching what Christian does. I know he has a lot of followers that are really excited. I don't know that it gets you to a place you can't get to with the old-fashioned way.
Yep.
Right.
So I think, again, it gets down to what's fun for each individual varies.
Yes.
Some people love that. We just got done watching this incredible presentation, by Mirko, and their integration of digital to be able to treat and plan all those orthognathic cases and all that. That's another one of those, hey, that would I rather have them doing that than the
Exactly.
old-fashioned way?
Right.
Exactly.
Totally.
Yeah.
Model surgery.
But there are certain things, model surgery.
Right.
There are certain things, like just if you want to make some changes for 6 or 10 veneers, or do a mock-up to see what crown lengthening is going to look like. It's awfully easy to do that with some flowable composite and a model.
And we know we can translate it to reality. And I think
Yeah.
that's
Yeah.
the thing that sometimes there's a struggle with,
Yeah.
is the translation of that information. If you give a patient a photograph that has been done using one of these digital software programs, that's kind of dangerous in a way,
Yeah.
because,
Yeah.
can we actually create that?
Yeah, obviously the whole Smile software stuff's been around a long time now. The original ones weren't terribly good, but it's been around at least 20 plus years. I have never used it in office. We've had it in office, but I've never actually used it with a patient for that reason. I don't ever want to show them something I'm not sure I could actually accomplish.
Yeah.
It looks too good. It's like the
So-
temporary that you don't want to make.
And so I have always used mock-ups. I mean, I did my first mock-up. We published an article in Quintessence, I think my periodontist and I, in 1987, of using a bisacryl mock-up, snapping it on to guide crown lengthening. And so in that's 31 years, that's been my way of communicating with patients. Not that the computer doesn't do it well,
Right.
but my fear has been I don't want them to look at that and come back to me and go, hey, this is the picture you told me I was going to get. Now, when you look at Christian stuff, I mean,
It's
he's pretty dang amazing.
pretty
Oh,
what
yeah.
he what he
Oh,
shows
yeah.
them they're going to get is pretty much what they
But-
get.
Right, but he's an
Is-
artist.
He's an artist.
And
Right.
there's
Totally.
a whole other side of that
Yeah.
is artistry with the computer. You
Yeah.
know, it really is
Yeah.
a thing. If you look at what Photoshop can do, I mean,
Yeah.
if you are a true expert, you're an artist at Photoshop.
Yep.
So I think it's very similar to a great lab technician, an artist with ceramics. I think Christian is that
Yeah.
guy that can
Yeah.
accomplish that.
And so I don't question at all that what he shows somebody, his result that he's going to get is going to be really close to what he showed them.
Yeah.
And there are other people in the world like that.
Exactly.
Boy, the hours that he's put in and the passion it takes, the commitment it takes to reach that level, I think that's a big
Right.
big
And people don't talk about that as much
No.
because it's not sexy.
No.
You know, the sexy
the
part.
pictures are the sexy
Yes,
part.
and that's what's so dangerous. As we've talked the other day about social media and how it sort of inundates us with kind of those before and afters, and we start to get focused on, well, this is possible, and yes, it is possible, but the amount of time and effort and capital investment
Yeah.
into all of this is often not talked about because and it worries me a little too. And we mentioned this several times that, you know, the people that are often producing the most of this kind of social media driven before and after type of thing, I'm like, are you really doing dentistry? Because you're just spending a lot of time posting these cases online, you know.
I would tell you that what I am aware of is helpful is to have access to somebody who knows how to do a lot of that stuff.
Yes.
Doesn't need to be you.
Yes.
So you had mentioned the lab, or like I could use the example of Doug Knight, the orthodontist. So does it make sense to work with somebody like Doug? If I was down in that community,
Yeah.
where I could say, hey, Doug, you know, I'll scan the case.
Yep.
I'll send you over this virtual scans in a bite, and can you tell me what you could do? Because he'll do it in a matter of minutes.
Yeah.
Oh yes.
In minutes.
Tremendous benefits.
And so I'm like, digital, I love it. I don't want to be the one that necessarily does it, but I love having access to somebody who knows how to do it.
Yeah.
Same with the laboratory. There's the laboratories that have some really sophisticated digital techs that can do some amazing stuff.
Yep.
Before we bring technology on the office, I think it's important to kind of evaluate, what we're going to do, and is it really going to affect the outcome or make it better? And what is it going to take for me learning curve wise and time? I think John and I talk a lot about time. When you buy a 3D printer for your office, but the time you figure it out because you're not doing as many reps as the lab, the ROI on that from the time perspective is it's almost, you can't even ROI it from a time.
And
but
that's assuming that it's as good as what the lab
Right.
has,
That's
which is a
assuming it
big
is good.
big if. I mean, we just had a published
Yeah.
in JPD where they said, they had some commercial or some kind of low level commercial printers, and they said they developed some surgical guides from those, and they were not accurate.
they were not good.
Correct.
And so there's a lot of question about, can you actually accomplish what the lab can accomplish
Right.
unless you get what the lab has? I don't know how far we can dumb that down cost-wise, or size-wise too.
And then I think for solo practitioners, the other equation that you have to put in there is not just even the ROI when you buy it, but how long is that product going to be supported by the manufacturer
man.
before
Yes.
the next one
Such
comes
a
out?
great
point. Such a great
Because
point.
in technology, I mean,
They
stuff
come
is
and
like
go.
18 months.
Yeah.
Yes.
18 months, and that's like in the trash can. You got to get. There's a good friend of mine who practiced in Dayton, Ohio. He still practices in Dayton, Ohio, and he loved gadgets. He loves gadgets, and so I've been to his office a bunch of times. And back in the 90s, I noticed one day that he had built this huge building next to his office. And I was like, what?
Is he milling his
That's
own
a
implants?
classic dentist move
What
right
is
there.
that? He says, I ran out of space to store stuff. And I said, what are you storing? And he opens the doors to when we walk in, and there's shelves all over. And he's literally got 5 different imaging machines on those shelves. He's got, every weird product you can imagine. He's got 3 or 4 of them.
Right.
Because sooner or later, and especially if they're technology products, they're just 18 months to 24 months.
Yep.
Right.
The window's over.
So what's some advice you could offer some listeners or about when to adopt technology? What would be kind of some metrics that you would use in your practice?
Well, I think, if we were taking something as simple as CEREC, CEREC's a much easier one to talk about because you simply can start looking at how many units potentially would you be doing a month with it. Currently, how much are you spending on your lab fees to do that many units? The fact that you're going to now only have one appointment instead of a 2-appointment process, you're not going to have temporaries to be made. So what's the hourly return? What do I gain in hours? Because you have to. It's not just the expense of the CEREC. In truth, you're saving some significant time.
Right. Right.
So that's I think that's a really easy conversation to have. Is okay. Whatever the CEREC cost is, it's X. It's going to be this many $1,000s a month. I do this many units. Currently, let's just pretend that to do a classic crown prep, impression, temp, bring the patient back in seat. Let's say it takes 2 hours just to make math easy. So if you did 10 crowns a month, there's 20 hours for those 10. Now, if your seat appointment was a half hour each, you just cut out. You gave yourself back, 2.5 hours, something like that. And you just reduce your lab bill by X, and during those 2.5 hours, you now could have done, 2 more units,
more dentistry,
or whatever. The harder ones are when you start getting into the technology that you referred to as difficult to measure the ROI. CBCT.
Right.
If you're doing a lot of implants,
Makes sense.
then it makes sense. Absolutely. If you're buying it just as a diagnostic imaging device,
Right.
that's
It's a tough pill to swallow.
we have some friends I know. They did it because I have some friends that have them that don't do implants. Instead, they bought them and they do CBCTs for their friends around them.
Yes.
Right.
So those other people didn't have to buy them.
Right.
So they kind of created their own little mini imaging center.
Yep. Yep.
But then that brings in the whole thing. Well, who's reading these things when you're
Right.
sending
Who's
them back and all
responsible
that?
for
So
what? Yeah.
that's a whole different thing. I think CBCTs, if you're doing implants, yeah, you're going to end up with a CBT in your office. You
Yep.
are. I mean, that makes sense. Scanners,
Right.
totally makes sense. In the world we live in, the ability to scan, the quality of scanners, the ability to, if you want to have a Great Lakes make an appliance and you've got a good scanner in your office, you can scan everything. You can, do the bite, send those files over, you get an appliance back, and they
Right.
fit.
Right.
Yeah.
Okay,
I mean,
great.
amazing.
Right.
So that, again, the efficiency of that makes sense. And then, the cost of scanners isn't so crazy.
Right.
I personally think the printer thing right now is still iffy because you can get inexpensive printers. You just don't know whether the accuracy of those inexpensive printers gets you where you want to be. And then when you start getting into the ROI to me on the stuff we were talking about, like smile design, how do you factor in the hours?
Oh man.
So that one, I don't. If you love it
Right.
and it's fun for you, then I think it's easy to say, okay, I'm not as worried about the money.
And that one,
just
I
do the
think
fun.
they sell it almost as this is going to increase your case acceptance. And maybe create false hope in what, like we talked about, what it can look like. Now, we can do that if we are Christian coaches and maybe some other high-level people. That's a tough one.
Yeah, it's definitely, though, I think from an interdisciplinary standpoint, I think what comes out of this is that's where the most value, I think, is
And it's
created.
it's changed the way
the
we do
treatment
things.
planning and the sharing of records and the ability to manipulate in a digital world. I mean, just take Invisalign even, right?
Yeah.
What you can do with Invisalign software to try different possibilities. That changes treatment planning radically.
Completely.
Right.
Yeah.
Completely.
So those to me are no-brainers. Those are places where you would never want to go back to the old world of how we did traditional setups, etc.
Absolutely.
Being able to duplicate what you're seeing in your office is so much easier today because I can take my iPhone or my camera and I can start videoing speech. I can start videoing lip at rest. I can just a simple phone.
Yeah.
And I can upload that to my lab technician, and that's the cheapest thing
Yeah.
you can do, a video camera.
And it takes so little time.
So little time, and to be able to do that before, back when you started your study club.
Right.
I mean, how valuable
Because
was
because we have companies coming out with facial recognition
Right.
to start to, and you see these case reports or these proof of concept studies, and it's very cool, it's very sexy, but then you go, with an iPhone and 30 seconds,
Right.
could I give you about the same information? Might be
Pretty-
able
pretty
to,
close.
pretty darn close, or just with some simple,
Yeah.
additive wax type of wax rims, or as we learned in Warren Dentition,
that's amazing.
yeah, just a simple,
Triad.
triad and
Essex.
exactly. Simple as that, and all of a sudden we have a lot of information.
Mike Gunson, who's a spectacular oral surgeon, who's going to be speaking here next year. He spoke here last year. Just beautiful orthognathic surgery, which is all he does is orthognathic surgery. And you talk about all the technology he's got, all the scanning, all the stuff. One of the simplest things he does when he wants to see what would happen if he moves somebody's maxilla forward is he takes a mouth mirror, slips it up under the lip, and pulls the mirror until he likes the way the lip drapes, and he measures how many millimeters forward he pulled the lip.
It works.
So-
And you can show that to a patient also, without maybe even in a better way that's more translatable than a really nice facial recognition.
I guess it's, I'm not, like I said, I'm not anti any of this
no,
stuff.
no.
But I think you just got to put a little practicality into what we do, where it's got to work in a practice
Right.
setting.
But it certainly has changed how we communicate
Yeah.
with our teams.
Yeah.
It's amazing. It makes dentistry better today.
Yeah.
Oh, for sure.
You would never go back.
No, never.
Never.
No.
I would never go back.
I was on Wednesday. Vince Kokich's daughter Mary and I did a presentation to our visiting faculty over at the center. And it was actually a topic she and her dad had put together and presented years ago to the Aesthetic Academy, and it was the art of effective teaching, basically. And so Mary and I have been meeting over the summer and putting this 90 minutes together, and I had some photos of her dad and I from the 90s sitting in Milan, Italy, with slide carousels piled all around us.
Wow.
And I was thinking to myself, I don't even know if I would have continued teaching as long if I had to have stayed in that world
Man.
where all you could do was go left screen, right screen.
Yes.
There's no animations, there's no dissolves, there's no...
Right. I think
Yeah.
about it, just from a teaching standpoint,
Yeah.
what it has done for you, what it has done for
Yeah.
this educational side of things, of how people can see things so much more easily and how much more quickly you can learn. I feel
Yeah.
like that's another area that it just has changed.
And honestly, even, taking it to the basic, you talked about like the 6 photos. So 6 photos and some templates, and you a couple minutes time to draw some teeth on the photos, send them to the orthodontist or the periodontist and say, hey, this is what I'm thinking. And when that, before the patient gets to their office,
It's huge.
that's nothing. It's 2 minutes.
Exactly.
Right.
It's nothing. It costs nothing.
Costs
Exactly.
nothing.
It's a digital camera and a little template.
Yes.
So,
so
Yes.
good.
Well,
So
I think
good.
it's just been such a good discussion.
Yeah.
It's such a practical discussion. We're excited about where we're going, but we also have to kind of remember where we came from.
Pay homage to
Yeah.
what
Yeah.
we used to know. That's our foundation.
Right.
And always looking back to that to say, okay, remember how we did it?
Right.
And is this really making the outcome better? And is it making me more efficient?
Right.
At-
And you
more
always talk
predictable?
about, the balance work-life. And I think that's critical here
Yeah.
is just remembering, that in the end, where do you want to be at 5 o'clock?
Yeah.
Dentistry's awesome. We love dentistry. But at the end of the day, I like my family too, and I
my
like
wife.
my time, and I want to be able to. And so I don't feel badly about saying, delegation, knowing an expert who can do this for me. It makes, I think, in some ways, my life a little
Yeah.
bit more smooth.
You get to go home and go, I don't have to deal with that
Yeah,
tonight.
there's something to be said for that. So,
Exactly.
well, Frank, it's been, of course,
Thank you.
a real pleasure having you talk with us about this. And if you're watching this and this has made a difference for you, we want you to give us some feedback, give us some comments. Check us out. Of course, this is live on both the Spear Education page as well as the Dental Guys page. We'd love to get more information about what you thought here. Give us your questions, give us your feedback, interact with with us. Thanks again to Frank for being with us. And so for Frank, for Wes, and John, we are the Dental Guys here live at the Spear Summit 2018.